This is by Dr. Vaisakhi Prasannan, who is a ex-resident from LVP and currently doing pediatric ophthalmology from Shroff Eye Hospital, Delhi. So she'll be talking on what after residency, whether to go for a fellowship or to start your own private practice.
Good morning to all. Once you finish your residency, the actual questions come. What next? And the answer to this is crucial because this answer decides the entire graph of your future or your career. First, we'll see what are the options you have after residency. You can join a fellowship, you can do a senior residency in a government institute, join a charitable hospital where you can do surgery as well as get trained in surgery. You can go join a good private institute, set up your own private practice, and also you have option to practice abroad. Okay, what are the questions you should ask yourself before you decide what to do next? Well, one is, what do you want to do in your life? What do you want to achieve? Or what is your goal in life? Where do you want to see yourself in 20 years? Where do you want to practice in the end? Whether it is a small town where you might need a comprehensive practice rather than a subspecialty practice, or is it a big city where you need actually to have any expertise in any subspecialty? Then what kind of practice is viable in your place? And finally, family, because ultimately you should have a good work and family life balance. First of all, we'll discuss about if you plan to pursue a fellowship. It's always better to pursue fellowship because it fills the knowledge gaps of your residency, as well as it helps you to gain advanced knowledge in a particular subspecialty, because some patients need actually expert opinion and management, and some conditions require a deep and vast knowledge and skill to provide them with actual treatment which they require. And it also helps you to gain more surgical confidence and training. But you should always know, do you have a genuine interest in a subspecialty so that you can pursue it as a career for lifelong and go deep into it. Also, you should know the demand and scopes of your hometown and should be aware about the professional saturation which is actually present. In fellowship, you should have to give a dedicated time throughout the 2 years in order to gain the adequate amount of knowledge and skill you require, and there should be adequate financial support also. Because by the time you finish your residency, you will be already in your late 20s or early 30s, where you actually are in a rush or in a responsibility to meet the needs of your family, and also you need to financially support your family. To pursue a fellowship at that point actually demands a lot from your family, and you need a proper support system both mentally as well as financially. Then one safe option, or it can be just considered as a transition phase, is that you can stay back in the hospital where you already got trained. Here it will improve your experience. It will be familiar environment where you can work at the same time as a consultant, and you will be widening your knowledge, and it will give you some time to get a broader perspective on how you want to establish yourself. Also, you can give your academician in you a satisfaction. The other option is joining an already established institute. Once you plan for joining an institute, it's always a question whether you have a fellowship, and it's an important thing to have years of experience before you join as a consultant in any institute. The advantages of being in an already established institute is that you will have ongoing learning from others who are like seniors or already established consultants. There you will have an assured number of patients. There is no need of investment, and there is no need of any tension for that. Then you will have financial security, you will have a decent amount of remuneration, it will give you good work experience, and even you have any doubts regarding subspecialty other subspecialties, you can have easy referral and get the patient the best treatment they deserve. The concerns are that you will always have targets to achieve, which can be daily or monthly. You will have inflexible duty hours. The remuneration you can get is always fixed. And also you are just an employee like any other person, and the patient actually come for the institute rather than to you. Finally, it's solo practice. This is like being your own boss. This is the most challenging but the most rewarding since it's challenging. Here there is no ceiling to your earnings. Once you are successful, you can schedule your own practice, your own timing, and the way you want to practice. And the disadvantages of being in a solo practice is that you need a proper planning, you need financial support from the family, you will have huge bank loans, and you need to be comprehensive rather than a specialist, or you need to be tied up with other subspecialty people. And the stress and tension of failure and investment returns will be there all time. It takes time and more effort to establish yourself, and hence you need to be patient initially. You will have to manage your OT and OPD together, and hence you have to be a good planner for that. And one thing is that you will have to learn from your own mistake. The successful career in private practice requires a knowledge. You should have good basic comprehensive knowledge. You would have good surgical skills. Observational, clinical, and communication skills should be good, and your attitude and confidence should be good. That patient, like, even if you know things, you should be able to convince convince the patient the same. And always the hard work, it's that which pays. Ultimately, there is no good or bad decision about how you plan your life to be. Never compare with the graphs of other people, because everyone will have different pursuits about your life, and everyone will have a different graph of their life. Always ask, what does your circumstances demand? Ask from your family as well as the place where you want to practice. And more than that, this should be the actual question. What do you want to achieve in your life? What is your final goal? Because it's the work satisfaction that ultimately matters. Thank you.
Yeah, it was a comprehensive and very good presentation, Vaishakhi. And one thing to add is, nowadays it's actually impossible to get out and have a practice without having a good fellowship. But the issue with fellowship is that the remuneration or the stipend that we get during our fellowships is very meager, and it's not even enough to pay off the rent of the house where you're staying. So then you need a financial support from your parents. So if you are a male and you already have a family, it will be difficult for you to, like, it is a humiliating situation to go and ask your father again for money for another 2 or 3 years. And on the other hand, if it's a female, they'll start compelling you to have your baby. It's 35, you'll have GDM, and they'll start telling all the excuses, and you will always be stressed. Fellowship period is not that easy. So that is there, but you have to overcome that. You have to get training and expertise, because nowadays ophthalmology is also getting very much saturated, and you have to be the best if you want to be known.